In this video I am going to tell you about Baclofen brand names, Lioresal, Lyflex. Find out how Baclofen relieves muscle spasms and helps manage conditions cerebral palsy, meningitis, motor neuron disease and multiple sclerosis. About Baclofen. Baclofen is a muscle relaxant. It's used to relieve muscle spasms, cramping or tightness caused by conditions such as cerebral palsy, meningitis, motor neuron disease, multiple sclerosis, conditions affecting your brain, spinal cord and nervous system. Baclofen is available on prescription. It comes as tablets or a liquid that you swallow. If Baclofen tablets or liquid do not work well for you or your child, you may be prescribed a Baclofen injection. This will be given by a specialist doctor in hospital. Baclofen can also be given through a pump that is fitted under the skin. Key facts: Baclofen reduces pain and discomfort caused by muscle spasms. The tablets and liquid start to work after 1 hour after taking it. However, it might take a few days before you find the right dose to control your symptoms. Common side effects include feeling sleepy and feeling sick, nausea. If your doctor decides to stop your treatment, your dose will be reduced gradually over 1 to 2 weeks. It's best not to drink alcohol while you are taking Baclofen until you know how it affects you. There's a risk alcohol may increase drowsy side effects and make you very sleepy. Who can take Baclofen? Most adults and children aged 1 month and older can take Baclofen tablets and liquid. The injection can be given to adults and children aged 4 years and over. Who may not be able to take Baclofen? Baclofen is not suitable for some people. To make sure it's safe for you, tell your doctor before taking it. If you have ever had an allergic reaction to Baclofen or any other medicine, have a stomach ulcer, have lung, kidney or liver disease, have a mental health condition, have epilepsy, have Parkinson's disease, have diabetes, have ever had a stroke, are being treated for high blood pressure, have difficulty peeing, have a rare blood disorder called porphyria, are pregnant, trying to get pregnant or breastfeeding, how and when to take Baclofen. Your doctor will decide the right dose of Baclofen for you. It's important to take it exactly as your doctor tells you to. Dosage and strength: Baclofen tablets come in 10 mg strengths. The liquid contains 5 mg of medicine in 5 ml. The usual starting dose for adults is 5 mg, half a tablet, taken 3 times a day, 6 to 8 hours apart. Your doctor will then gradually increase your dose to 20 mg, taken 3 times a day. If you're given Baclofen injections, the dose will depend on your condition and symptoms. The doctor will start by giving you or your child single doses to see how the injection works. If your symptoms get better, a special pump can be put into your chest or gut. This allows the medicine to be given continuously. For babies and children, your doctor will use your child's weight or age to work out the right dose. How to take it: it's better to take Baclofen tablets with or after food. If you or your child are taking Baclofen as a liquid, it will come with a plastic syringe or medicine spoon to help you measure out the right dose. If you do not have one, ask your pharmacist for one. Do not use a kitchen teaspoon as it will not measure the right amount. How long to take it for: you may need to take Baclofen for a long time to control muscle spasms. If you've been having Baclofen through an injection or pump for a long time, you may find that it stops working as well as it used to. You may need to stop having treatment for a short time to give your body a rest. Your doctor will be able to give you advice on this. If you forget to take it: if you forget a dose, take it as soon as you remember. If it's less than 2 hours until your next dose, it's better to leave out the missed dose and take your next one at the usual time. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. Stopping Baclofen: if you stop taking Baclofen suddenly, you may get withdrawal side effects such as feeling anxious or confused, seeing things that are not there, hallucinations, seizures or fits, changes in mood or behavior, a fast heartbeat, muscle spasms getting worse. Your doctor will reduce your dose gradually before stopping it completely. This will help prevent these side effects. Important: do not stop taking Baclofen without talking to your doctor. If you take too much, taking more than your prescribed dose of Baclofen can cause serious side effects such as feeling unusually sleepy, drowsy, difficulty breathing, muscle weakness or spasm, seeing things that are not there, hallucinations, feeling agitated, seizures or fits, feeling dizzy or fainting, a slow or irregular heartbeat. Side effects of baclofen. Like all medicines, baclofen can cause side effects in some people, but many people have no side effects or only minor ones. Side effects often improve as your body gets used to the medicine. Common side effects. These common side effects of baclofen happen in more than 1 in 100 people. There are things you can do to help cope with them: feeling sleepy, tired, dizzy or weak, feeling or being sick, nausea or vomiting, diarrhea, headaches, problems sleeping, dry mouth, rapid eye movements, blurred vision or difficulty focusing, excessive sweating or mild rash, increased need to pee or pain when you're peeing. Speak to a doctor or pharmacist if the advice on how to cope does not help and a side effect is still bothering you or does not go away. Serious side effects. Serious side effects are rare and happen in less than 1 in 10,000 people. Tell your doctor or call 111 if the whites of your eyes turn yellow, or your skin turns yellow. This may be less obvious on brown or black skin. This can be a sign of liver problems. You have difficulty breathing while you're sleeping, sleep apnea. You are having more muscle spasms than usual. Serious allergic reaction. In rare cases, baclofen may cause a serious allergic reaction, anaphylaxis. Call emergency now if your lips, mouth, throat or tongue suddenly become swollen, you're breathing very fast or struggling to breathe, you may become very wheezy or feel like you're choking or gasping for air, your throat feels tight or you're struggling to swallow, your skin, tongue or lips turn blue, gray or pale. If you have black or brown skin, this may be easier to see on the palms of your hands or soles of your feet. You suddenly become very confused, drowsy or dizzy. Someone faints and cannot be woken up. A child is limp, floppy or not responding like they normally do. Their head may fall to the side, backwards or forwards, or they may find it difficult to lift their head or focus on your face. You or the person who's unwell may also have a rash that's swollen, raised, itchy, blistered or peeling. These can be signs of a serious allergic reaction and may need immediate treatment in hospital. Reaction and may need immediate. Baclofen and pregnancy. Baclofen is not often recommended in pregnancy. However, if you need baclofen to stay well, your doctor may recommend that you keep taking it. Talk to your doctor about the benefits and possible risks of taking baclofen in pregnancy. If you take it in later pregnancy, your baby may need to be monitored for withdrawal symptoms. If you become pregnant while taking baclofen, then contact your doctor. They may recommend reducing your dose or gradually stopping the medicine. Baclofen and breastfeeding. If your doctor or health visitor says your baby is healthy, you can take baclofen while you're breastfeeding. It's important to keep taking baclofen to keep you well. There is not much information about taking baclofen while breastfeeding, but information shows that it passes into breast milk in small amounts. It has not been known to cause any side effects in breastfed babies. Contact your health visitor, midwife, pharmacist or doctor as soon as possible if your baby is not feeding as well as usual or seems to have a dry mouth, seems unusually sleepy, is sweaty or develops a rash, is being sick or has diarrhea, is causing you any other concerns. Baclofen and fertility. There's no evidence to suggest that taking baclofen will reduce fertility in either men or women. But speak to a pharmacist or your doctor if you're trying to get pregnant. Non-urgent advice: tell your doctor if you're trying to get pregnant. Breastfeeding. Cautions with other medicines. Some medicines and baclofen can affect each other and increase your risk of side effects. Tell your pharmacist or doctor if you're taking any of these medicines before taking baclofen. Other medicines to relax muscles such as tizanidine lithium, a medicine for mental health problems, antidepressants such as amitriptyline, medicines that lower high blood pressure, non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen, levodopa, a medicine for Parkinson's disease. Mixing baclofen with herbal remedies and supplements. There's not enough information to say that herbal remedies and supplements are safe to take with baclofen. They're not tested in the same way as pharmacy and prescription medicines. They're generally not tested for the effect they have on other medicines. Common questions about baclofen: how does baclofen work? Long-term chronic muscle stiffness can happen in conditions where the nerves that supply your muscles have been damaged. In these conditions, the muscles shorten, contract tightly, and can then become stiff and harder to use. This is called muscle spasticity. Baclofen works by relaxing your muscles, which reduces pain and discomfort. How long does it take to work? Baclofen tablets and liquid start to work after 1 hour of taking it. However, it might take a few days before you find the right dose to control your symptoms. Baclofen is usually started at a low dose and slowly increased over a few days. What will happen if I stop taking it? If your doctor decides to stop your treatment, your dose will be reduced gradually over 1 to 2 weeks. This will stop you getting withdrawal symptoms such as feeling anxious or confused, seeing things that are not there, hallucinations, seizures or fits, changes in mood or behavior, a fast heartbeat, muscle spasms getting worse. Are there any long-term side effects? Baclofen is unlikely to do you any harm if you take it for a long time. But if you have been taking it for a long time, do not stop taking it suddenly without checking with your doctor. Normally your doctor will reduce your dose gradually over a couple of weeks to reduce the risk of side effects. Will it affect my contraception? Baclofen does not affect any type of contraception, including the combined pill or emergency contraception. However, if Baclofen makes you sick, vomit or have severe diarrhea for more than 24 hours, your contraceptive pills may not protect you from pregnancy. Check the pill packet to find out what to do. Find out more about what to do if you're on the pill and you're being sick or have diarrhea. Can I drive or ride a bike? Baclofen may make you feel tired, sleepy or dizzy and can affect your vision. It might be best to stop driving and cycling for the first few days of treatment until you know how this medicine makes you feel. It's an offense to drive a car if your ability to drive safely is affected. It's your responsibility to decide if it's safe to drive. Talk to your doctor or pharmacist if you're unsure whether it's safe for you to drive while taking Baclofen. Gov. UK has more information on the law on drugs and driving. Can I drink alcohol while taking Baclofen? Alcohol may increase the drowsy sedative effects of Baclofen tablets and make you very sleepy. It's best not to drink alcohol while you are taking Baclofen until you know how the medicine makes you feel. Is there any food or drink I need to avoid? Apart from avoiding alcohol, you can eat and drink normally while taking Baclofen. Will recreational drugs affect it? Using cannabis, heroin or methadone with Baclofen will increase the drowsy effects of Baclofen. It can make you go into a very deep sleep. There's a risk you will not be able to breathe properly, and you may have difficulty waking up. Using cocaine or other stimulants like MDMA, ecstasy and amphetamines with Baclofen can also make you drowsy. Talk to your doctor if you think you might use recreational drugs while taking Baclofen. Might use recreational